Okay.
And then sometimes we'll have patients say, yeah, when I brush, I bleed. I think I'm brushing too hard. And that's one of the things where I'm flossing too hard. And then hygienists and I look at each other, we're like, that's because that's what a lot of people think. And we're like, we need to educate.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we are coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. But we know that exercise is not the only piece of the puzzle, and that is why we are bringing you a rock star guest today, none other than Dr. Sean Abrams. Dr. Abrams is a dentist and associate at Village Smiles in Elk Grove Village. He graduated with his doctorate in dental surgery in 2006 from the University of Illinois, Chicago. Dr. Abrams, welcome to our show.
Thank you both for having me.
Absolutely. So tell us more about your story, how you got into dentistry and kind of how that has evolved your view of health and what you do in your practice today.
Okay, thank you. When I was young, growing up, I always loved animals. And my career path I thought was going to be veterinarian. I went to University of Illinois, Champaign-Urbana. Actually, I think it's called Urbana-Champaign now. It wasn't then. And I studied animal science. And I realized quickly, growing up in the suburbs, that wasn't for me. I ended up meeting a good friend of mine that went there. His mother was a dentist, and he was on his track to becoming a dentist. And I realized quickly that that was something I wanted to do, just because the health side of it, which I loved all the sciences, and the artistic side of it as well. And the combination of, basically that being the entry into our whole body as well, which is really, really big, and that's where dentistry is really going right now. So I went on that track. I graduated from University of Illinois, and I ended up being an assistant in a dental practice in Buffalo Grove, and then I realized quickly that it was what I wanted to do. And I went on to become a dental lab technician after that, and then I went on to dental school at UIC. After I graduated, I really wanted to do something to give back right away, and I worked in 2006 to 2009. I was working at a practice up in, actually a community dental clinic up in Beloit, Wisconsin, seeing the underserved community up there, and that was really rewarding, and I learned a lot as well. And then I went on to private practice in Palatine, and now in Elk Grove.
That's awesome. What a cool transition from just knowing that you like science in general, knowing you like the health field, thinking that you're wanting to go, into veterinary practice, working with animals, but then realizing that, hey, that's not for you. What was that transition like? Because you found dentistry through your friend, but when you were kind of going through, were you sure that the health-related field was still something for you, or were there questions as far as maybe I need to kind of scrap this whole thing and just go a completely different direction?
No, I knew right from the beginning, just working in the offices, which is why I did that at first, that's what I wanted to do. I loved the patient relationship, and I loved what the dentists were teaching the patients and the actual work. And the hours don't hurt either compared to being a medical doctor.
Sure.
So,
yeah.
Which is great.
What was you said you were a dental lab technician?
Correct.
What does that mean? What was that involving?
Dental lab technicians, they make a lot of the appliances that patients wear, whether it's crowns, bridges, the crowns for implants as well. They make removable appliances like dentures, partial dentures, things like that. So it was a 2-year track, and I went through that, and then I worked at a lab for a little bit right
Very
after.
cool. Very cool.
Great. And what was it like working in Beloit? And you said you were working with some underserved populations. What was that like? Or were you shocked by anything or surprised by anything?
Not too much, because the patients we saw there were very similar to the patients we saw at school that we worked on. So it was an easy transition, and they were very appreciative for us to see them because they had nowhere else to go. And I learned a lot there because I was able to do a lot of things that I wouldn't or necessarily have to do in private practice, where I had to do difficult extractions, removing teeth. That was one of the main things that I did there that I learned really well how to do in case I have to do them, and I realize what I can do and what I can't do. Right. And now if I think something's going to be very difficult, I don't want the patient to go through that experience. Something I might not be able to do as better, or as good as somebody else.
Sure.
That's awesome. It sounds like it was incredibly valuable experience for you there. That's really cool. Very cool.
I think when we're put in those situations where we're pushed to explore and do things either repetitively or on a more extreme side than what we would in normal practice, we gain a ton.
Correct.
So I felt like that in my first personal training job. I was like, oh my gosh, all my cases are way too difficult for me. But it made me really so much of a better trainer. So that's cool that you got to have an experience like that as well.
Yes, definitely. It was great.
So now, do you take those experiences and kind of bring them into your current practice as far as the services that you offer? Does it go beyond what you might find at a kind of traditional dental practice?
It does. It actually went both ways. There were things I did not do there that were completely new to me when I started practicing in private practice. And one major one was implants. I didn't deal with that much at all.
Sure.
Because those patients cannot afford them.
Sure.
So I learned that very quickly working up in Palatine. And I learned a few things. Other things I did learn besides the extractions were dentures. Because a lot of patients, instead of implants, they had dentures fabricated. So I learned a lot about that, so I got very good at that as well.
Yeah. I loved how you said, in dentistry, you liked learning about the health and the science, but also there's an artistic side of it. And I like that you said that because as much as anyone that studies a science-related field, whether they're in health or training or MAT, whatever we're doing, we always want to be like, yeah, it's all science. All we do is the science method, and I think dentistry is a perfect example of how there's an artistry to it because, well, number one, people are looking at your smile, but number two, and how that can apply to dentists and then other practices is how are you practicing? How are you doing the procedures? I know there's always a standard of care for each thing, but then there's also, the personal touch to it. And then you kind of led that into how the mouth is the entry to the entire body. And I don't think any of us ever think about it that way, but it's so true. Can you expand on that idea and what you mean by that, or some of the cause and effects things that you might see in your practice on a day-to-day or week-to-week basis?
Sure, no problem. One of the things that we do at our practice, and I'm hoping a lot of other practices do this as well, is we take blood pressure on every new patient and any recall appointment, which is their quote unquote 6-month cleaning appointment, and anytime we get them anesthetized. So, and we realize that not most patients, but there are a lot that do not see an MD regularly or any other physician, and they don't even know what their blood pressure is. And as a lot of us do know, that is not good. So we take that, and if we see that it's elevated, we will wait 5-10 minutes, take it again. Sometimes our cuffs are temperamental, and we will look at it again, and then we'll go from there. If it's high, then we have a threshold that we use at our office that we will not treat. If it's if the systolic and diastolic are certain numbers, we will not treat them. We'll recommend that they go see their physician if it's really high, emergency room or physician right away, and then come back to us, and then we'll try again. Most of the time, they're very appreciative of that, and they go ahead and do that, and then we can get them treated.
That's awesome. So then what's the idea with how oral health, or is there a tie between oral health and blood pressure, or oral health and kind of the other vital signs that might be checked at a regular physician's visit?
Definitely. If someone has high blood pressure, they can bleed more. So when we do certain procedures that, like as I mentioned before, taking teeth out, extractions, that's something we have to be concerned about. We have a procedure that our hygienists do, which has numerous names, but a lot of patients know it as a deep cleaning, where we numb patients up and we go down underneath the gum tissue and clean their roots off, and that can cause bleeding as well. So we have to be very cautious of that. One of the big things or I should say big factors with affecting the rest of the body is periodontal disease, which, if gone untreated, it can affect diabetes. It can lead to heart disease, stroke, and there's other things, systemic, conditions as well that it can affect. But those are the main three that we talk to patients about, and a lot of patients don't know they even have it. Sure. Again, going back to blood pressure, just like high blood pressure, a lot of them don't know they have it. Sure. So it's something we try to educate them on.
So for our listeners, can you explain what periodontal disease is?
Sure. So we diagnose it by doing two diagnostic tests or exams. One is taking x-rays. If we look on the x-rays and we know about where the bone level should be, if there's bone loss, if the bone level is lower than it should be on the teeth and more of the teeth are sticking up out of the bone than they should be, then that is bone loss. And the other one are the probing depths or pocket depths, where we use a little tiny instrument called a probe, and we go in there and we measure their gum tissue. Both of those together come to the conclusion that there's attachment loss. Now we can get deep pockets with just inflammation and no attachment loss. There's a ligament around the tooth that connects it to the bone. And if that attachment of that ligament is compromised, then there's bone loss, we have periodontal disease. And that can, again, affect numerous areas of the body.
Is perio something that is completely preventable by just lifestyle care of your mouth and teeth, or is there a genetic component or an unavoidable component of it?
That's a really good question. There is definitely a genetic component. Sometimes it just has to be maintained. And then there's other components as well, not taking care of your teeth. One of them, smoking, can lead to it as well. And then I said diabetes before. So those are the main risk factors for periodontal disease.
And then when someone, how you had mentioned perio seems to be, accompanied by or correlated with some other issues that may occur, like stroke or heart issues, diabetes. Is it that perio leads to these things, or they kind of go hand in hand? When you're losing health in one regard, you often lose health in the oral area as well.
I'd say, yes and no. I mean, diabetes can be both. One can lead to the other with periodontal disease. Heart disease and stroke, it's a lot of this is inflammation based. So if you have a lot of inflammation in your body, then that can lead from one thing to another. And a lot of people think the mouth is just separate, and it's not, obviously. And because we're so specific with our field compared to medical doctors, that people don't think that they're related. And then obviously if you sit and think about it for a minute, you would realize they are. And I know a lot of people do realize it. We just don't think about it on a daily basis.
Yeah. Where do you think the disconnect comes? I mean, I know if you know me personally, you guys probably all know my family is in the dental field. So I always grew up knowing, like, okay, brush and floss, it's like mandatory, and then maybe a multivitamin, whatever. Like, the health of your mouth was just really emphasized in my, my world growing up. So I never had that disconnect. But where do you think that disconnect comes from, where the mouth is this separate entity of the rest of your body's health? I don't know if you've picked that up just from conversation from patients, or do people just view the mouth as something that could be pretty or less pretty? I don't know.
I think more of it's two things. I think one is the way we're taught in medical school and dental school. We were basically taught the waist up, and our anatomy classes and everything we did. Medical school, I'm assuming they learn about the mouth, but they don't take a lot of time on it because there's dentists that's their field, right? That's our field. So I think that's basically the way we're taught, in school. And I just think aesthetics are one of the big things people look at when they think about their mouth.
Sure.
They don't think about the health of it as much as what it looks like.
Right.
And they go hand in hand a lot of times.
Yeah.
Sure. Yeah, I definitely never think about the health of my mouth until something is sensitive or something feels inflamed or I floss and I strangely bleed. I'm like, what? I must be, swollen from something, and it's true. And I think we probably all think about that with our bodies too. It's like, I feel great until something doesn't feel great,
Right.
So that's interesting. And I think you're right. We all think about the aesthetic of the mouth. I guess it's kind of true with working out too. We all think, I got to look a certain way, even if the function might not be optimal.
Now, one thing you brought up that was very interesting to me is the idea of how oral health can then relate to, other diseases or other disease processes throughout the rest of the body. And you brought up this idea of inflammation, how if people's mouths are really inflamed, that may be an indicator or that could be a precursor to some of these other issues that could go on. So with that in mind, a couple of questions with that. One, what kind of checks, or do you have certain checks that you do with your patients to try to identify, hey, you know what, your gums are really inflamed, your cheek walls are really inflamed, or anything like that? And then two, do you have certain bits of advice that you give to your patients if they have more inflammation, or I guess as part three, do you have tips of advice if people are looking to reduce the likelihood that they get inflamed?
Yeah, we do. My hygienist and I have 3 hygienists in my office, and they're great, and they educate the patients really well. And when we see things that are kind of red flags, it could be body weight, it could be, and then their tongue's enlarged, their gums are inflamed, then we start thinking of a bigger picture. And one thing, other thing, as far as the obesity or the tongue goes, there's one of the things that dentistry has moved into recently, trying to emphasize with patients, is sleep apnea. And that's something that we really look for as well, because people don't know they have that either. And that's a huge thing right now, because that's extremely debilitating. And looking in their mouth can really tell us, a good idea of if they might have it. And that's something that we really try to focus on. So I would say, with the inflammation, again, if we're seeing high blood pressure, and then again the periodontal disease, because we don't do any blood tests obviously, but we will have them see their physicians and say, we got a lot of possible autoimmune conditions going on here. I think there might be, or we treated them and they're just not responding. We would either refer them to a periodontist, which is a specialist, a gum and bone specialist, or we would refer them to their physician to have them checked to make sure that everything is okay.
Very interesting.
I know you mentioned the body weight, enlarged tongue, and gums inflamed. Are there other signs, like someone could look in their own mouth and be like, wow, I think I got some inflammation going on? Because I think a lot of times, I don't know if I'm wrong or not, but it's not like someone has inflammation for a day that leads to a chronic issue. Maybe if they have inflammation from a day, they just irritated it or something's weird. But it seems like the inflammation in the mouth would kind of build up over time, or, it's a chronic issue. Or is it normally more acute? It
can be both. It can be both. Yeah.
Yeah. And then for the chronic one, how would someone know that they have that if it's kind of a normal? Because if it's chronic, it didn't just happen yesterday, and then they can compare from the day before.
Correct. It's, again, a lot of times they don't. Sometimes patients who do have it, they come in and we'll ask them, we'll check their gums. We'll take the x-rays if it's a new patient. And we'll go around, and then there can be a lot of bleeding, or if there is a lot of bleeding when we go around with our probe to check the pocket depths, that's not good. I mean, we don't want there to be bleeding with that. There should be healthy gum tissue, shouldn't bleed when we do that. Okay. And then sometimes we'll have patients say, yeah, when I brush, I bleed. I think I'm brushing too hard. And that's one of the things where I'm flossing too hard. And then I look at each other, we're like, that's because that's what a lot of people think. And we're like, we need to educate. And it's not, if you're brushing too hard, then I mean, if you do anything too much, you can cause yourself to bleed.
Sure.
But on a daily basis, you shouldn't be having that happen. And the issue there is that there's, again, infection, inflammation in your mouth, and that's what the problem is. So we would tell them, that you have periodontal disease and we need to treat it.
Yeah, that's interesting, and I think you're right. If people bleed on the daily, because I actually asked my father about this, who's a dentist, and I was like, "Is it normal to bleed when you floss?" And he goes, "Well, let's just say this: the gum is supposed to be the barrier between the blood staying in and your mouth." And I thought, okay, so I should be bleeding every day. But yeah, that's interesting. And I think you're right. I think if it was me, I would probably think, oh yeah, I should just cut back on the brushing. But maybe there's actually an issue going on there.
Correct.
I really appreciate the way you got your office. I don't know if this is normal, but I know when I go to the dentist, I don't get my blood pressure checked. But I like that you guys kind of almost take a whole body view, because one thing we find with exercise, at least, and I think it's cool when we see it in other fields, is that a lot of times we think if we're trying to improve our health in any way, oral health, body health, weight health, heart health, and let's say I want to work on my heart health, then I do things that I might think my heart will get healthier from, like go running or go biking. But what we fail to realize is that biking and running involve other things, like your orthopedic system, like how are your joints doing? And so sometimes we think, oh, if I'm getting this part of my body healthier, it's okay if I compromise the other parts. And I like that you guys take that view, because it's so true. I mean, if you're going to be doing a procedure where you could be, potentially having more bleeding than you would have to, or, whatever other issues may arise, it's really cool that you guys, address that and bring that up with patients and help them get educated on more than just, their oral health.
Another thing to expand on that is we'll obviously look at their medical history with medications too. So there's certain medications we might have to recommend their physician stopping before we do a procedure as well, like for instance blood thinners, and that kind of expands on that as well.
One thing that I've noticed from people that I know and clients of mine that have had oral procedures done or oral issues is when the mouth or the oral health is not up to par, it affects the entire rest of the body, just how they're feeling, how they're thinking, how, just whether they're achy or not, or things like that. And to me, that just highlights the importance and the significance that your body is placing over, the oral health, of itself. Meaning, hey, if your oral health starts to go downhill, it's almost like your body starts to downregulate everything and you just feel awful. It's really interesting is, somebody has, like you're saying, a tooth that needs to be pulled, or something, their gums are all inflamed or something like that. It's very interesting how that impacts the rest of the function of their bodies. Do you find, am I biased in that view, or is that something that you see as well, that, hey, when people come in and they have a toothache, like it's really affecting a lot of other systems in their body?
Correct. 100%. Yeah. And that's the worst kind of appointment that I want to see, because we feel horrible for them. And we try to do everything we can to get them out of pain. It 100% can affect that. I mean, if someone, I have been lucky not to have tooth pain, but from my patient's point of view, I've heard it's worse than childbirth. So,
wow.
So that's a lot of them said that. And and the men, they just, they just can't, obviously they can't say that, or they say it's worse than my wife's childbirth. But they look they're miserable, and they want anything. They don't want to do anything else except get that tooth, pulled out of the bone. And sometimes it's not the right option, so we have to go over that with them. But most of the time, it actually is, and then we do what we can to help them.
Sure. Yeah. So what are some things that you might find that people could implement in their own life to kind of avoid that? Hey, let's make sure your teeth stay intact, that, you know, the health of your teeth and of your gums and of your tongue stays, you know, at the optimal level.
You know, like you hear all the time, of course, brushing twice a day. And we recommend electric toothbrushes at our practice, not necessarily because they do a better job overall, which there's some people that say they do, some that don't. I think for me, it's more that does the work, and it's less technique sensitive, and they also are timed.
Yes.
So that's, you know, another reason why I would really recommend having an electric toothbrush. Now, flossing, I recommend that, again, once a day, but I use a water pick. I don't know if you're familiar with that, but it's a device that just streams water, and you just basically shoot it through where your teeth touch. So right below that are the gums, and you just flow the little wand in there, and it shoots water in there, and it flushes everything out. I use that almost every night instead of flossing, and I do floss a couple times a week as well. And we've implemented that in our practice in 2013, and we have seen unbelievable results.
Really?
So it's been, I am 100% behind that. And I get nothing from them.
You need to call. We need to get link them in this podcast.
Exactly.
No, we recommend a lot of products, and because we believe in them.
Sure.
And another thing is fluoride. A huge thing that we recommend. It's a big controversy. A lot of patients, you know, believe in it. We have some that don't. They think it's toxic, and whatever everybody believes, that's up to them.
Sure.
But we've seen results, and that's all I can go off of, and history that shows it works.
Yeah.
And we recommend that for everybody, not just children. Dental insurances, for the most part, just cover it for, I think I want to say maybe up to 18. I'm not the person to ask about that, but they typically will not cover it for adults. And we recommend it for everybody to have 2 fluoride treatments a year. And I do it myself because that basically helps with the resistance to bacteria, and the bacteria can't, the byproducts can't break down the tooth structure as well, and we don't get cavities as much. So it's a huge thing that we implemented as well. So those, and then a mouth rinse is good, an antibacterial mouth rinse regularly if you need it.
Sure.
We don't want to do overkill if you don't need it. And then of course seeing a dentist, you know, twice a year or however much you need to.
Sure. So the fluoride is that's in addition to, say, using a toothpaste that has fluoride in it or something like that. Okay. All right.
Toothpaste it's a smaller amount.
Gotcha.
This is a much more concentrated amount, which is safe for the 2 times we do it per year.
Awesome.
It's funny because I think Charlie and I work in a industry where I think we're a little more holistic, and you know, we're viewing everything. We want to be unique and all that stuff. So we hear a lot of, you know, people that we know that are also against fluoride. And I can only talk from experience. I'm not in a lab deciding if it's toxic or whatever. But I remember even one time I had an x-ray and the dentist said, oh, you have a little bit of breakdown of your, what is that top layer called?
Enamel.
The enamel. And he told me, okay, just start doing, you know, every day the fluoride wash, like the most potent one. And by the next time I went back, it was better, and I didn't have that issue anymore. So I was like, sweet, I don't have to get a filling, because that is the most uncomfortable thing I have ever had in my life. So it is really cool and powerful stuff.
I was going to ask, so you brought up a mouthwash, and you said if you need it. So what did you mean by that? Was it like if you feel like you're not doing a good job brushing, or you're not flossing as much as you should? What would be some indications that you should be using the mouthwash?
Well, there's different patients that have, you know, different issues, or some might not have any. So for a patient who just comes in every 6 months and looks great, their pocket depths are great, no cavities, nothing, they don't need to do anything else. They're doing a good job with just brushing and flossing. And some, you know, we don't even know truly, you know, when I went to the dentist, I always used to tell them, you know, before I went, I'm like, well, I flossed maybe a week before I came in here. So, and I would not advocate that, but but and I did have a few cavities when I was younger. So they do tell us that, that they are doing it, and we hope they are, but we can only go by what they say. And some people, more than others, need more help than others do. So if we, if we see the inflammation, if we see cavities, we would recommend a mouth rinse either with fluoride as well, or one that just has an antibacterial component.
Gotcha. So, okay, that makes sense.
Is a personal question. Is there a negative side to using it like every day if you haven't been told that you need it?
No.
Okay.
Not at all.
Great, because Charlie and I are Listerine lovers, and we're like, every night, let's burn our mouth. It's like an acquired sensation,
Really love the burn.
Yeah, love the burn. So I had a question about what you see on the day-to-day. And because in my view, I think everyone's like me, and they just go to the dentist, get clean, they're like, all right, you're good, see ya. Is that what you normally see, or are you normally doing more intensive, extensive procedures and dealing with more complex things than just, the hygiene checkup, the dental checkup? Oh, you're good. Keep brushing, keep flossing. It's
funny you say that and you're specifically talking about me. Okay. Because when I went to when I was younger, I used to go when I went to the dentist, I'm like, God, this guy has an easy job. He just sits in his office, comes in, looks at my teeth, says they're okay. Maybe looks at some x-rays and then goes back to his office.
So you became a dentist off of that perception. I'm just kidding.
Exactly. No. So, but what you don't realize is that I'm in another room with the patient treating them. So, I'm in the room, and I go ahead, and the hygienist will come and they'll be like, I need a check. So I'll just leave them for a minute or two, and, up to, a few minutes, and then we'll go ahead, see the patient in their chair, and then I'll go back. So I'm doing all sorts of treatment.
Sure.
Ranging from fillings, root canals, like I said, dentures, implants. We do Invisalign as well at our practice, which I wanted to expand on that a little bit too.
Sure.
Yeah.
That Invisalign has really become a really good tool to use to help people become healthier. So it's not a aesthetic treatment option for us. That's a side effect. So when people have crowded or spaced, teeth that are spaced out, again, it goes back to gingivitis, periodontal disease. They're going to have a hard time cleaning their teeth, and that can lead to inflammation again. And we have problems, or teeth chipping because they're not in the right spot. Jaw issues with their jaws hurting them, which can lead to headaches, neck pain, things like that. So we actually recommend Invisalign for that reason, and for anybody out there who's not not familiar with what Invisalign is, it's clear aligners that move teeth. So they look like retainers, and they move your teeth instead of braces. They're a little more limited than braces are, but for the most part, we can do a lot of things with them.
And can you use those with all age ranges of people? Or is there like a certain minimum age you have to be?
We can. Wow. I don't, in my practice, I pretty much do late teenagers and adults, but they can be done with anybody.
Very cool.
Any age.
You don't often think about Invisalign for just keeping oral health up. You always kind of think about them as getting my teeth straight so they look good when I smile. But it's a really good point. You brought up some really good things that I didn't think of those things before. So that's awesome.
Yeah, it's something that I think the dental community as a whole did not think about either.
Sure.
Until within the last, I'd say 5-10 years,
Sure.
there's been a big push with that.
That's awesome.
It does, and we've seen the results.
Sure. Well, and also when you had said, it helps with their health, I didn't think what you said. I actually thought, because after I got my braces off, I had one that looked like Invisalign, just those clear plastic ones, but they don't change, progressively. And I remember I had to wear those, I don't know, maybe for a month after I got the braces off, and then you just do it at night, or I don't remember the protocol. But I remember thinking, okay, I got to put them in, and then if I'm going to eat or drink coffee, then I got to take it out and then brush and then put it back in. So it really got you in a routine of like, my mouth is the kingdom of all health, and it will not be affected by any food, coffee, or any other acidic item, and I thought that's where you were going to go with it, which I think probably people get healthier from that too, because they can't just grab a cracker or grab a, something when they're just passing by at the office or something. They actually have to, okay, let me pull these slobbery things out in front of all my coworkers, and then, cut off the little spit line, and, and then eat the cupcake.
That is so true, because you brought up a really good point. That is 100% true. Almost every single one of my patients who's in Invisalign says it's the best weight loss program they've ever had.
Oh,
so because they don't snack anymore.
Yes.
And they don't want to take them out, because then they have to brush, and they don't have. I mean, they can just rinse their mouth out if they haven't eaten, too many things. But they do say that to us, and then they don't mind. They like it.
Yeah.
That's
Plus,
hilarious.
they're getting another benefit. Their smile is becoming beautiful.
Right.
So we'll now recommend our weight loss clients to go see Dr. Abrams, because he's going to fix more things than you think.
No, that's so funny. I was going to ask kind of what the feedback was from your patients on using those versus traditional braces. And it sounds like it's going over really well.
Yeah, they like them. I mean, it's one of the big things with Invisalign is compliance. I mean, you can take them off. Braces, you can't. So, you have to make sure the patients are going to wear them. And for the most part, all my patients have. I mean, I haven't had any issues with it at all.
That's awesome.
And we've seen really good results.
Are there any populations that it would be contraindicated for using the Invisalign, or as long as you kind of hit the certain age minimum, at least at your office, they're good to go?
Yeah, they're good to go.
That's cool.
Yeah.
That's awesome.
Well, Dr. Abrams, I know we've spoken about the relationship between the health of the mouth and the health of the rest of the body, and it sounds like it can kind of work both ways. So what I'm curious about is what things you do to kind of keep up your own health.
I actually, funny you should ask, because recently I changed my own diet within the last few years, and I used to be a pop drinker, and I no longer do that. I also watch my carb intake as well.
Awesome.
And I basically limit the portions that I eat as well.
Sure.
Because now that I'm 44, I have to start doing those things.
Sure.
First my eyesight went, and then I do wear glasses. I can't see. So, but I didn't need those till my late 30s, and now and then I basically watch everything I eat right now.
Awesome.
And it's
cool.
been great. And I exercise 2 to 3 days a week. I try to as much as I can.
Perfect.
I know one of the big excuses you both probably get is time.
Yeah.
And with 2 kids at home, and my career and my wife's career, it's not easy, but we both make time to do it.
That's awesome.
So.
And we both know your wife, so I'm sure she keeps you busy. All scheduled. Everything must be in the schedule.
Exactly.
Yes. So
that is true.
We actually talked about Jenny in our previous podcast. So if you have been listeners, you guys know she's the organizing queen of Schaumburg and all of Chicagoland.
That's awesome. So Dr. Abrams, talk to us about how our listeners can connect with you, connect with your office, and if they're interested in getting scheduled up with you, how can they go about doing that?
Sure, thanks. We're our website. You can look that up at www.villagesmiles. Actually, it's village-smiles.com. Our phone number is 847-985-5552. We actually are part of Decision One Dental Partners. That's an awesome group in the Chicagoland area. We currently have 25 locations. You would not know that we are part of that going to our office, because we are all individually run. We're dentist run, and we basically have specific systems that we do that make us work, but we try to keep the small town feel with each office, and we just get support from them. So it's an awesome thing, and I love it, and I've been part of that now for 5.5 years.
Good for you.
So you can go on their website as well, which is www.decisionondental.com.
Beautiful. Very cool. Now, Dr. Abrams, the question that we like to wrap up with all of our guests is, what is your definition of health?
I actually had to think quite a bit about this one, and I knew you guys were going to ask me that.
I like it.
So a healthy person, well, I wrote down a healthy person more than just health, but is someone who continues to make smart choices that are positive to the function and maintenance of their body and mind. And I think that's, if you continue every day to try to do that, I think health will be part of your life.
I like so much about that because you're not talking about one state. You're talking about the process of continually making decisions that bode well for overall health. It's not like you reach this level and then it's like, oh, now you're healthy and you're good. It's like, no, even if you maybe on the charts are relatively unhealthy, you are making the decisions day in and day out to trend towards health and to trend towards healthier. And even when you get into that healthy zone, it's still about continuing to make those decisions. So I can really appreciate where you're coming from with that.
Yeah, it's something you have to work at every day.
For sure. Absolutely.
Like brushing your teeth every day, twice a day. In college, I used to hand out pieces of floss to my roommates. All right, we're all flossing together. No one flosses. I'm serious.
That's great.
Well, Dr. Abrams, thank you so much for joining us. We so greatly appreciate your expertise, your time, you're just being here with us and kind of sharing your viewpoints on health and dentistry is really a joy. So thank you.
Thank you so much for having me. Really appreciate it. It was a great time.
Right on. Absolutely. So for our listeners, who do you know that needs to hear this episode? Who do you know that's maybe struggling with their oral health that needs to find out about the work Dr. Abrams is doing? Share this episode with them so they can get connected with Dr. Abrams and his practice. We're going to put the contact information for everything in the show notes, so make sure to check that out. And while you're there, if you wouldn't mind, leave us a rating and review. It helps other people find the content that we are putting out. So if you found value in this, it would mean the world to us if you left us a rating and review. Well, have a fantastic week, and we'll talk with you all next week.